I'm going to pick up where I left off, and we're almost finished here with my portion of this lecture. But we were talking about the ASAM criteria, and again, that's the American Society of Addiction Medicine. Uh, so ASAM has a set of criteria, and you'll see because I've provided links for you on in this module on Canvas. But they set up some criteria that helps to guide a clinician to have these conversations with their clients, to help guide clinicians in a direction to provide the most appropriate level of care. And so a good example of that would be if a client has never, ever, ever sought treatment for an addictive use disorder, and they are coming to you and you guys together have decided that reaching out for treatment for an addictive use disorder, or the beginnings, maybe they're in sort of the mild stages of an addictive use disorder, according to the DSM, and you guys have determined that treatment options are appropriate and your client has decided that's the route that they would like to go, it would be inappropriate for you to refer them to a long-term inpatient treatment center. So long-term inpatient treatment centers are very involved. They remove the client from work obligations, family obligations, et cetera, et cetera, et cetera, to work on addiction. Now, this client has not been unsuccessful at a lower level of care. Let's just say maybe outpatient treatment. So again, there's a protocol set forth by ASAM that determines or helps to determine the most appropriate level of care. And you're looking at things like the potential for intoxication and withdrawal. You're looking at biomedical conditions, emotional, behavioral, and cognitive conditions, their level of change, readiness for change, likeliness of relapse or continued use, and the most appropriate recovery environment. So that piece, the recovery environment, runs the gamut of things from, at what level of use is your client currently at. It can also consider multicultural considerations, etc. Again, I just want to make sure that I touch on this, that I make sure I mention to you. We are going to talk about ASAM criteria again in, I think, 2 weeks. So put the seed, I'm putting the seed in your head right now because we're going to talk about it again. Useful information when you do an interview. Obviously, again, this goes back to your skills class, but these are basic bits of information, with the exception of making sure that you identify and discuss their addictive behavior. And then, of course, again, going into addictive behavior, any sort of treatment for addictive use disorders they may have had in the past, and maybe what happened resulting in relapse and them seeking treatment again. All right, so that's it. Here's some useful information. That's it for my lecture. Again, we'll talk about ASAM criteria again. You've got a couple of assignments, or excuse me, actually you only have one assignment, and it's to practice an assessment. Practice your interviewing skills, practice asking some questions. I want to make sure that you hear me when I say, when you do this audit on a friend or a relative, make sure you tell your friend or relative, do not use real answers. Make up your answers. And this is to protect your client, or to protect your friend or relative, and to make sure that this is an experience for practice only. You are not meant to be doing an actual screening tool or assessment on anyone. You're not at that stage yet. We're just practicing here. So make sure you tell them, make up the answers. Okay. Let me know if you have any questions about that.